you had a spine surgery many years ago where they had to do a laminectomy, where they cut a piece of bone in the spine to take some infection out, right?
Correct.
So when was that surgery?
Approximately 88.
Oh, so a long time ago.
Yeah.
And unfortunately, the way to get to the spine and take the infection out is to cut the bone. Yet the bone is there for a reason. If it didn't need to be there, it wouldn't be there to start with. Meaning that when we do this kind of surgery, we create what we call iatrogenic instability. That's a fancy word for saying that we doctors, we go there, we make a spine unstable. But it did work for a while. When did you start having symptoms again?
As far as back pain, it would stiffen up, but it would always go away.
Mm-hmm. How many years have you had symptoms?
Probably about 5.
5 years. So it worked. That surgery didn't have an immediate impact on you, but many years later, it did have an impact on you. And you told me that you're mostly worried about your walking. Tell me about it.
Right. Well, we used to do a lot of walking, and it just steadily got to the point that I can't even make it a block.
Mm-hmm.
And now, since I've got put on that nerve block, I suppose that's what Zymbalta is.
Yeah. So the practical, let's go a little further back. So you walk a block, and then the pain get how bad? When it's bad?
Yeah. It would get to the point that I would start to sweat from
Okay.
pain.
Can you give me a number?
Yeah, probably 8 or 9.
8 or 9. So it's really bad pain. You start sweating. Literally, your system is want to shut you down, and you're not imagining it. Can you explain to me what happened and how have you been treated since January?
Again, it's steadily. My leg would, if I lay on my back,
Mm-hmm.
would literally jump.
Mm-hmm.
And I can't sleep on my back. I went to Mayo after the first of the year, and they did the MRIs, and we met with the doctor, and they did all kinds of tests with the nerves and all that, and pretty well said that it was the lumbars that were putting pressure on that nerve, and that we could try physical therapy or some drugs. And
so they didn't dispute that there's a problem there. They saw that there's a problem there.
Right.
Okay,
right.
so for 9 months, this is going on, instability in your spine and compression of the nerve is going for 9 months. So what has been the treatment plan for that?
Just taking the pills. That's all I've done.
I have truly difficulty to understand how pills are going to fix that mechanical problem. And there's nothing wrong with giving it few weeks time, but 9 months is a long time. And this is exactly what our protocols are for. We are still going to try a certain thing. We are going to put you in a brace to stabilize your spine, strengthen some of the muscle and so on. But in our protocol, the time frame that we are willing to give it is 6 weeks. If you are not better in 6 weeks, we will go there and fix that problem. It is okay to start it slow, but this is not something that you sit on 9 months. A baby could be born in 9 months.
Yeah.
So we will start that process, and then within maximum 6 to 8 weeks, we should have a solution for you.
Okay.
Any question?
No.
Okay, thank you so much.